Hi, I'm Peg Luksik, candidate for U.S. Senate from the state of Pennsylvania, and this is part 3 of our analysis of House Bill 3962, Nancy Pelosi's health care bill. Question 6. What does the Comparative Effectiveness Research Trust Fund do? In the last section, we talked about a new tax imposed on people who have private insurance to fund a comparative effectiveness research trust fund. What does it do? Well, it provides money for the Center for Comparative Effectiveness Research. That's described in Section 1401 as a center to conduct research with respect to the outcomes, effectiveness, and appropriateness of healthcare services and procedures, to identify the manner in which diseases can most effectively be treated and managed. There will also be an independent Comparative Effectiveness Research Commission to recommend national priorities for research and advise the center. The research will be used as clinical decision support to promote the timely incorporation of their findings into clinical practices. In other words, the results go into what happens to you in your health care. Now, the bill contains language saying that no federal official or employee can exercise supervision or control over the practice of medicine. There is also language that says that nothing in this section of the bill can be construed that will make healthcare more stringent or change the standards for coverage under this act. That sounds like protection, but it's not. This act, as we have already seen, allows for rationing. So setting the bar on legal language that allows rationing is really not a protection against rationing at all. Question 7. Do I have to buy insurance? Somebody has to pay for insurance for you, whether you actually have it or not. There are several options. Your employer can provide you with coverage. If he does, Section 412 mandates that he send to the Health Choices Commissioner, the Secretary of Labor, the Secretary of Health and Human Services, and the Secretary of the Treasury information that the Commissioner may require to ensure your employer's compliance, including information on your employer, certification of the benefits you receive, the months when coverage was available, the monthly premium you paid, information on every employee who's covered, along with the months for which your particular coverage was provided. Your employer must contribute at least 72.5% of an individual's premium or 65% of a family premium. Your employer must offer insurance to part-time employees, contributing a portion of the premium that matches the portion of the hours they work versus a full-time worker. Your employer may not change an employee's salary to cover any additional premiums. Or your employee can opt to contribute to the Health Insurance Exchange Trust Fund instead of providing you with coverage. This option is described in Section 413. The employer will pay an 8% payroll tax on full-time employees or a partial tax on part-time employees. None of this tax can be used to pay the premium of an employee under the public plan in which the employee is enrolled. All of the money goes to the Health Insurance Exchange Trust Fund. Question 8. So if my employer takes the 8% penalty, am I without insurance? Yes, you are without insurance. Question 9. Do I have to buy my own insurance? If you don't buy insurance, Section 501 says that you are subject to a 2.5% tax on your income. The tax is not used to purchase insurance for you. Question 10. What is the Health Insurance Exchange Fund that my employer is contributing to? The Health Insurance Exchange Fund is described in Section 307 of the Act. Its money comes from taxes on individuals and businesses who do not have private insurance or provide private insurance, and from the United States Treasury. The contribution from the Treasury is specified as being the amount of payments made by the fund reduced by the amounts collected from the taxes I just described. That means there's no upper limit on the amount the fund will pay. The money in the trust fund is used to pay for affordability credits for low-income individuals and families. That's described in Section 341. The credits can take the form of a reduction in the premium or a reduction in the cost sharing for a particular medical procedure. To be eligible for the credit, a person must be enrolled in an exchange participating insurance plan, not be covered by their employer, and have a gross income below 400% of the federal poverty level for their family size. There are a number of additional technical adjustments, but basically the program is to help low-income families pay for their premiums or their cost sharing. Question 11. So, am I paying for someone else's health care? The short answer is yes, you are. Let's run the numbers. A company has 50 employees with an average salary of $50,000. If they take the 8% penalty tax, they will pay $4,000 per employee to the Federal Health Insurance Exchange Trust Fund. That means about $334 per month per employee. They can't provide health insurance for that employee for that amount, so it makes business sense for your employer to take the penalty. The employees of that company now have no health insurance, and the money that the employer used to direct toward insurance plans for his own employees is now being directed by the government to pay for insurance for low-income individuals. Question 12. Then what happens to the employees of that company? Well, they either have to purchase their own insurance through the government exchange, or they will have to pay the income tax penalty that will also be used to provide insurance for someone else. This is a de facto pay cut for those employees. They will lose a benefit that many of them are currently receiving, and they'll have to come up with money out of their own paychecks to replace that benefit. This is income redistribution, taking money from one segment of the population and giving it to another segment of the population. But it's hidden in the requirements of this bill. In our final segment, we will be talking about some of the particular mandates in the bill that reach way beyond what a normal person would consider when they talk about reforming healthcare.